Hello everyone, welcome to my YouTube channel, Dr. Jaggi's Academy. Today I'm going to discuss about the new medication which is approved for postpartum depression in Canada, and that is Zuranolone. So in this video, we will discuss what is Zuranolone, then its use in the postpartum depression, how it is to be taken, about its onset of action, what are the precautions for breastfeeding while the woman is on this medication, side effects of Zuranolone, and other options in postpartum depression, other options that we can use in postpartum depression, and then the comparison between SSRI and Zuranolone. So let's start. So what is Zuranolone? It is a synthetic neuroactive steroid. Means in our body we have allopregnanolone, which is a metabolite of the hormone progesterone. So allopregnanolone is a natural neurosteroid, and zuranolone is a synthetic form of allopregnanolone. And how does it work? Actually, this zuranolone is a analog of allopregnanolone, so it mimics the actions of allopregnanolone. And how it acts? It acts on GABA-A receptors. So as a result, what will happen? It will produce the antidepressant actions. How? By enhancing GABAergic inhibition. So postpartum depression is very common problem. What happens after childbirth? Some women gets low mood and associated symptoms. And what kind of the symptoms can be there? So she can have the depressed mood, and she can have severe mood swings, severe anxiety, panic attacks, intense irritability, anger, feeling of worthlessness, shame or guilt, and all these things actually impair the bonding with the baby. So it is a very awkward position for a woman. So Zuranolone in postpartum depression. So it is the first medication specifically approved for managing postpartum depression in Canada. In fact, this was already approved in USA by FDA in 2023, but it is approved by Health Canada in 2025. So as per the guidelines, it is recommended to use in moderate to severe cases of postpartum depression. So now some points how it is to be taken. So it is to be taken once daily, one tablet by mouth once daily, and it comes in with a dose of 50 milligram. So when is the best time to take this medication? The best time to take this medication is in the evening. Why? Because it causes drowsiness as the side effect. So if a person will take in the evening, it will mitigate its side effect of drowsiness. And how it should be taken? Should it be taken empty stomach? Should it be taken with food? So it is recommended that it should be taken with the fat containing food. Why? For its best absorption. Its bioavailability is best if it is taken with the fat containing food. And for how long it is recommended? Duration of use. So it is recommended at this time, it is recommended to use for 14 days. Now coming to onset of action. This medication is a very fast acting medication, and studies have shown that it start producing its action as early as in 3 days. You can see quite a remarkable thing that antidepressant medication start working very fast. Now, this is a very important thing to understand. Now, a woman on postpartum depression start taking this medication. She can ask whether I can breastfeed while I'm taking this medication. So, answer is no. So, it is advised women should not breastfeed while taking the medication. Reason being is because we need more research to find whether this medication is safe for the baby or not. Okay? Till then, it is advised not to breastfeed. Coming to side effects of zuranolone. The most common side effect of zuranolone is drowsiness. That is why it is recommended that it must be taken in the evening time. And second thing is that it is recommended not to drive for at least 12 hours after each dose. Then in some person it can produce diarrhea, fatigue, the symptoms of cold, nasopharyngitis, and Zuranolone comes with the black box warning. And this warning is for all antidepressants. Basically, we must monitor the symptoms of the patient. In very rare cases, it can worsen the symptoms and suicidal thoughts can also come. So this is the black box warning. If it happens, so it must be stopped immediately. So this is common with all antidepressants. So now, till now, what kind of options we had till now for the management of postpartum depression? Till now, we were using the selective serotonin reuptake inhibitor like SSRIs. But SSRIs have limitation, and because this is a internal antidepressant, this is not a specific medication for the management of postpartum depression. Number two, it doesn't work quickly. It needs at least 2 to 3 weeks for onset of action, and it must be taken for a longer period of time. So because of these things, so postpartum management was not properly managed with the help of SSRIs. Now, last thing we can discuss the difference between SSRI or Zuranolone. Means in what kind of persons we can give SSRI and in what kind of person we can give Zuranolone. Let's see first see the case of SSRI case. A woman with a chronic case of depression. She had depression before pregnancy, during pregnancy, and after pregnancy. So, see, this is a chronic case. You need a medication on a long-term basis. So, SSRIs are recommended in this condition. Let's say Zuranolone case. So, there are no prior symptoms of depression. All of a sudden, she gets symptoms of low mood after postpartum or sometime in the third trimester. So, this is the case where we can use the Zuranolone. So this is all the points that I want to discuss. So thank you for watching our video, and you can subscribe our channel for more clinical updates, and you can follow us on the our website, Instagram, Facebook, and LinkedIn. Thank you once again.